Well, welcome back, Kevin.
Yes.
So glad to have you back on the show. And we are going to this particular time for the next 20 minutes or so. We're going to focus and zero really in on enrollment, on the
Yes.
enrollment period coming up. You have your brochure. You just got done with all of your certifications. I did not realize that you had to do that every year.
Yep.
That's crazy. That's a lot.
It's for the carriers, and I have some of the big main carriers that, and the reason I know you can get appointed by tons of carriers, but I try to narrow mine down to just a few because that's what most people ask me about. That's what most people want. Some of the bigger carriers have the biggest networks, and they're very competitive. So, like I was talking about earlier, and I'll touch on two different enrollment periods that I think are extremely important. What we call turning 65. Turning 65, I used to concentrate on like 6 months before that. Now I'm concentrating all the way back to the early 60s because people need to be prepared when they get ready for Medicare, what's available. And again, some people want to work past 65. Some of them think they have to go on Medicare at that point, which they don't. So when I sit down, I review what the options are. And one of the biggest things we concentrate, of course, if I'm 60 and a half is your initial enrollment period. That's when you can actually start talking about Medicare. You can go on Social Security, SSA.gov or Social Security, or call Medicare, and you can start your Part A and B. The effective date will be the first day of the month you turn 65. But there's going to be a lot of agents calling people in that age bracket and telling them, oh, we can help you out up to 6 months prior. The initial enrollment period actually is a 7-month window. It's 3 months before, a month of, 3 months after, which means you're guaranteed insurability to get whatever you want, regardless of what your health is. And depending on what way we sit down and think is the best for you, that's a pretty big deal. So when the initial enrollment period, when I start to talk to people, even if they haven't started the process 3 months before, I'll tell them how to get signed up for Part A and B. And the biggest thing then is as soon as they get their A and B effective date, they'll get with a Medicare number, which is basically their identification number going forward. It's a combination of letters and numbers. That'll they used to have your Social Security number on there. They don't do that anymore. So once they get to that point, I can help them start the process. And then, of course, once they get that, then we can talk about, do you want to stick with A and B, have a Medigap to cover that, and then Part B separately as well? That depends on a person's situation in life and their budget. If people travel a lot, stuff like that, that's probably a good option. If a person just doesn't want to be bothered with having to get referrals and worry about networks, that's probably a good option. Otherwise, we talk about Medicare Advantage as well. Medicare Advantage is what I mentioned earlier. You have your A, your B, your D all together. They call it a Part C Medicare Advantage. And then again, it can be an HMO or PPO. But when I sit down, some agents push one or the other. 6 and 6. I tell them exactly how they both work. Make sure they understand. We get them signed up. So the initial enrollment period when you're turning 65, very important. And just another quick thing there, a lot of people now are working past 65 and they don't want to start Medicare. It's important because if you turn 65, you can start Part A, but if you're going to stick with your employer coverage, or if you have that other credible coverage, it's important, credible, you don't have to start Part B. Part B is what initiates the initial enrollment period. You only have one of those. So when you start Part B, that's when the enrollment period starts for the initial enrollment period. Now, with that being said, it's important people know all that because if you are getting ready to go on Medicare and you don't have credible coverage, let's say you decide not to start Part B because it's $185 a month. Well, if you don't start it during the initial enrollment period, you have a 10% penalty for every year you don't have it, and it's a locked-in penalty. It doesn't go away.
That's crazy.
Yeah, but it gets better. Part D prescription, which a lot of people tell me, well, I don't take prescriptions. Why do I need that? If you don't get Part D prescription when it's available and you don't have credible coverage, it's a 1% penalty per month based on the national average of a drug plan forever. So those are little things people don't know about. So
why is that?
Well, it's because they want people to sign. There's lots of reasons, but the
Like the
government.
more people that are using it, the better off everybody is, kind of thing.
Well, yeah, not only that, because if you don't get Part B, which is your outpatient, you don't get Part D with your prescription when it's available, then eventually your health turns and you can't afford to get them at that point. Then you're going to have to get coverage from somewhere, and other entities are going to have to pay
Mm.
for it. So they encourage people to do it with a penalty. A lot of people think, oh, it's government trying to charge more money and all that. Well, it's necessary. And it's important people understand that. Now, if you continue to work and have credible coverage during that time, it's not a big deal.
So this is only if you are still working at an employer and you have, or if you're self-employed and you have your own through like the healthcare.gov or whatever.
Any type of credible health coverage, yes.
So,
and prescription.
So would they kick you out of those? Like, I guess I never even thought about this, but I mean, I'm not anywhere close to 65, so who knows what it'll look like whenever I get there in 20 years. But if you are still working, do you want to try to get onto Medicare? Like, what would be the reason not to?
Well, I just went recently to a person's house. I'll give you two examples. 65, worked for UPS, been there 45 years, and now all of a sudden he's retiring. So he's not going to be able to carry over that coverage. So he's a perfect person that he's in an initial enrollment period to go with the Medicare plan. If I'm talking to you and you're working for, I don't know, Lockheed Martin, and they have a great benefit package, and it doesn't cost very much as an employee benefit, we'll sit down and we'll say, well, is it better to keep that? We'll go over your monthly premium, what your deductible is, co-insurance, and we'll say, well, you would pretty much be paying this per month per year. Or if you go with Medicare, it's $185 for Part B, then depending on what way you go. So what's more cost effective? Sometimes it's way more cost to go with Medicare, cost effective, and sometimes it's better to stay in what they have. And people appreciate when you tell them the truth, and I'm never high pressure, ever. So that's another situation where we would do the one-on-one and determine what's best for you and your family. Now,
but inpatient is always there. You said because Medicare Part A,
yes. It's hospital, what they call
hospital.
Yes.
Okay.
So you can get that at 65, whether or not you get Part B, whether or not you go on other coverage. Now,
I got you.
And then the other,
and it's included because you've been paying for it. You
correct.
said, okay, got you.
Which means you got to, and there's a lot more to that. You have to have at least 40 quarters of employment throughout your life or your spouse in order to get that. So there's a lot of parts to it. And then the other important one, of course, is the annual enrollment period, which I've been doing a lot of work recently, setting up events and everything, getting ready for that. That is October 15th through December 7th. That's when you can actually make a change. You can talk about different plans. You can change from one Medicare Advantage to another. You can change to a prescription drug plan to another. That doesn't have anything to do with the Medigap. You can do that year round. But Medicare Advantage is Part C, and Part D, you can make changes during that time. You can make as many changes as you want, but whatever you have in place, like I said, by December 7th is what's going to be effective January 1st. The important part about that is I start to talk to people about Medicare 2026 as of October 1st. So we can get them ready. And a lot of times we'll make an appointment. That's why some of my events are set up before that time. I can't talk about the plans now in detail. So I wait till after October 1st, but I make that initial contact. And then after the 1st, we can actually review and say, hey, what do you think looks great? And then after the 15th, which I already have appointments set up, we can get them changed if they want to. And, sometimes people want to wait all the way to the last minute, which is fine. But as long as you get it done by December 7th, you're good to go.
So what are the general reasons why someone would want to switch their plan?
Many. For instance, let's just concentrate on networks. I mean, if you have carrier A and carrier B, some of them might have Baylor Scott White. Some of them might have Texas Health Resources, Southwest, whatever. Some people are really, really committed to Baylor Scott White network. So they want a plan that has that in it. There's certain carriers that do, and there's certain carriers don't. Doctors have an option to take anything they want. They don't even have to take Medicare Advantages. And if they do, sometimes they only want to take PPOs, not HMOs, because they don't want to have to worry about a network. Some clients want more freedom, like a PPO or a Medigap, so they could pick their own primary, they could pick their
Mm.
own referrals. So it just depends on a person's situation. Now, from one year to the next, that might change. Big part last year, like I said, there was the prescription drug plan. They put a gap or a cap on it. So your total out of pocket cost now on Part D with Medicare is $2,000. In 2026, I believe it's going up to 2,100. That means if you're taking medications, the Medicare formulary is based on tiers one, two, three, four, and five. Tier one and two, generic, and then tier three, four, and five is brand and specialty. So they're expensive. So the good news now is there's a $2,000 cap out of pocket. So if you were taking specialty, you're not paying year round anymore. Once you hit that, you don't pay anything else. The other part of that, a lot of them last year before they started this rule, there was no, a lot of them didn't have deductibles. Now, pretty much every single prescription plan, whether it's standalone or part of Medicare Advantage, has a deductible if you get like tier three, four, and five. So there are so many things, Jenna, to talk about, but those are the important things. And that's why I talk to so many of my clients every year that are current clients and other people. Well, I'm going to stick with what I have. And I said, well, that's great, but we should at least talk and so you know what's available, whether or not you change,
Mm-hmm.
because some people are, we can look up your doctors, we can look up your prescriptions so you don't have to guess. A lot of times seniors will call me and say, hey, what happened? My doctor's no longer in the network, or they don't cover my prescriptions. Well, if you go over that during that period, then you'll know that you won't be surprised. That's the biggest thing. I cannot stress enough how important that is.
Yeah. Well, I mean, I can also see that people wouldn't want to change because it's overwhelming to change. I
It
know the
is.
plan I have now, so it's like why it's basically you're learning a whole new thing. And that's why
Absolutely.
you have you so that you don't need to do that as much. You can have somebody to explain it to you.
Well, it's funny you say that too, because a lot of people, if they are working for an employer and they have coverage, and even if you go over both options, whether you stay here or go here, sometimes the biggest fear is just a transition.
Yeah.
I mean, I'm used to going and paying so much a month and paying this copay and that co-insurance and having this deductible. Now, if I change, it's kind of similar, but it's different. People going from one Medicare Advantage to another, they have to get used to maybe a new carrier, a new network, whatever. Sometimes doctors are in both networks, sometimes they're not. And then not only that, sometimes people have Medigap, but they want to go to a Medicare Advantage.
And what's Medigap?
So Medigap is like the supplement. You can get a Plan N, a Plan G, and that's the one that would be secondary to Medicare Original Part A and B. So whatever A and B doesn't cover, you get a gap to pretty much cover all your out-of-pocket costs. And so you pay a monthly premium, and it pretty much takes care of all your out-of-pocket. If those people switch to a Medicare Advantage, I should have mentioned this earlier, that's more a pay-as-you-go. There
Mm,
may or may not be a monthly premium, which is appealing, but you may not have a copay for your primary care doctor, but if you go to a specialist, it might be $15 to $30. If you
mm,
spend time in the hospital as an inpatient, it could be, I don't know, $250 for the first 5 days to $395 for the first 7 days. So, and then you have copays for maybe lab work and x-rays and MRIs. So that's the biggest transition. People, instead of paying a monthly premium, now you pay as you go. You have co-pays, and some people don't mind it, and some people don't want that bother.
mm-hmm.
So all those little things are important. Yes.
Yeah, it definitely makes a difference because well, and I understand the copay and the idea behind a deductible because it has people choose what's really important because
Yes.
it can get to a point where you can, and I worked with doctors that would come into assisted living where some of these patients were on so many medications and they
Yes.
were like, but when you don't have to pay for any of them, it's like, okay, well, go ahead, just put me on that.
You're
And then they
exactly
end
right.
up being on them for years and years. And the doctor's like, do we really need this still? I don't know. They're 98. Why are we still on a high blood pressure medication when
Right.
they're, so there's all these different things. But when it comes to like open enrollment,
Annual enrollment.
I mean, annual enrollment, sorry, I keep
Well,
it. I'm glad that you
well,
said
the
that.
reason I interrupted you because there is an open enrollment now too. The open enrollment is actually January 1st to March 31st. That is, they started that several years back. That's for people that maybe didn't get a chance to review their coverage, maybe made a mistake, maybe were misled. So they can change from one Medicare Advantage to another during that period. So it
Wow.
gives them almost a second chance. But the annual enrollment is what most seniors, if you ask them, they'll know the dates. I mean, because they're already starting to get calls and everything, and they always call me. Hey, I had someone call and ask me if I had original Medicare. They had someone call and ask me if I had Part C, which they know they have. It's to confuse them. So
I wish that we had some kind of rules about that.
yes, me too. Well, I was
That's a
wondering.
whole other
It
episode
is.
because
It is.
it's bad.
But my advice to my clients and any senior group I talk to is just if you don't recognize a number, don't answer. I know that sounds simple. If it's important, they'll call back. They'll leave you a message. Most of the time, even if you answer it, hang up, try to call back, you won't be able to get back in touch. So and then a lot of seniors are single, so they'll be watching TV and they'll need something to do. That sounds horrible, but they'll call that
No,
number. So
it's
you got to be
absolutely true.
yes, you
It's
got to be so
absolutely
careful.
true.
And I try to send that simple message, and that's why I'm a great source to call because I'll tell people the truth, whether I can help or not. Like another great, I didn't even mention this: veterans. I'm a vet, military, Army,
Thank
82nd
you for your
Airborne.
service.
Yeah, so I have a lot of vets that think the only option they have, even when they get to Medicare, is the
It's
VA,
the VA.
and it's not. So sometimes the vets they won't start Part B, which is a mistake, and they'll just go to the VA. I have the VA benefits, but I also have personal insurance, and the reason I like that, and I explain this to my vets with Medicare, it gives you two options. If the VA tells you one thing, you can have a second option. And if you go with the Medicare Advantage, most of the time it's a zero monthly premium, whether you use it or not. Plus, you get additional benefits on the Medicare Advantages, like maybe over the counter credit, free money, maybe a gym membership, maybe transportation, dental, vision, hearing, whatever. That's all stuff, even if you're at the VA, you can continue to use. They don't uh, uh, coincide with each other, two completely different things. So yeah, veterans are. I should have mentioned that early on. I have a big block of veterans, and sometimes they use the plan, sometimes they don't. But it's a at no cost plan just in case. That's how I explain. But you have to have A and B. So if any veterans out there are listening, you're getting ready to turn 65. Now's the time to talk to me so I can explain why you might want to consider Part B.
I'm very glad that you mentioned open enrollment and getting a bunch of phone calls. And I'm very glad you mentioned the loneliness side.
Yes,
And so
that's real.
Here is the deal. If you are listening to this and you're in Grand Prairie, first of all, Kevin is a real person, a human being that's sitting in front of me. We know who he is. We know where his children go to school. He lives here in our community. He's not some random person calling you on the telephone. If you get that person calling you on the telephone, call Kevin.
Yes. No, you're exactly
because
right.
you can verify, just like what you said. If you are looking for something to do, you are going to be doing first of all, these events are something that people can actually attend. So in the first episode, we talked about the events. We'll post them again on this one, but you actually do stuff at the summit as well.
I was going to say the neat thing about places like the summit, and I'm barely over 50 now, so I can join there. So
I still have another at least 30 years. Just kidding. I just have like 4.
So, and you're at least 50 when you start getting AARP stuff through the mail. But
and when you walk into the summit and you know you're getting to that age because they don't question why you're there anymore. They're like, oh, are you here to?
Well, I recently joined the summit as a member, and as a result of that, if you go to the summit, I'm doing events there as well. I'm doing vendor tables in the lobby. It's like an open forum, and then I'm also doing presentations in the theater. So if you go to the summit, you can see their newsletter, all the dates I'm going to be there. At the Jenna will put on my site. You can call me directly. You can email me, and then you can go to my website if you'd rather do that. Check out my website, all the things about me, and you can submit a consultation request, and we can do a consultation as well, free. Everything's free, no consultation, free reviews. And the reason we do that is because I really believe if I sit down with someone, explain things clearly that they're confused about, I'll have them as a client for a long time. So, and another thing is I have a lot of clients that I have coverage with that are under 65, and I can help the transition when they turn 65 easier. We have a relationship. They trust me. And another thing is I have a lot of good clients here in Grand Prairie, and a lot of people know each other. So if you treat people right, they're going to give you names of other people as well. So that's why I'm really focusing on Grand Prairie, and this is so awesome.
Well, next time, maybe what we can talk about are some of the providers and opportunities people have in the city to protect their health before they need a lot of these things. So we have so many opportunities on the show to talk about so many things that you and I are both passionate about this. I did not realize I was so passionate about working with seniors until I worked in assisted living and I started doing estate sales. And now I work exclusively with seniors, both as a real estate agent, as an estate sale provider, but then just navigating the whole system and watching it. I'm like, this is something I'm really glad to have somebody that's local, that can
Well,
be a local expert.
I want to mention a couple other quick things. So I deal with, I've mentioned this a couple times, a lot of low income people. And sometimes, depending on the income level, whether they're single or married, they might be able to qualify for Medicare, which maybe they have too much pride and they don't want to try to
Medicaid.
Medicaid.
Mm-hmm.
But I mean, if you qualify for Medicaid, you absolutely should try to get it because it puts you in a whole different category with the plans available. Eliminates all your out-of-pocket costs, may even eliminate your Part B monthly premium, gives you additional money every month to pay for over-the-counter healthy food. A lot of the plans, and you just touched on this, they offer either discounts or free gym memberships, and
Mm-hmm.
the whole reason for that is so seniors can get out and talk to other seniors. You can work out. It's all preventative things, but most importantly, it's socializing.
It is.
It's socializing, which is so important for seniors. And a lot of seniors that are single and they have a couple of health problems, they get very sedentary. They
Yeah.
just sit around doing nothing.
Yep.
So, like activity directors, like the place you used to work at, that's why they're so important to keep seniors busy. And I can make a bunch of suggestions for that too.
Yes. And the show I was telling you about, The Man on the Inside, I told you need to watch that.
I will do it.
They say in it, the number one cause of health problems in senior adults is loneliness.
Oh, absolutely.
Because what happens is the second that you start getting really lonely, well, first of all, we pretend like people over 55 don't have any more social anxiety or they never have to make new friends. Like, no, it goes until the end of your life. Trying to make new friends and all that stuff is always going to be an anxiety that they feel. So, but what happens as you get older, the simultaneous thing is that it becomes harder to get out of bed because your health starts to change. So if you're not active, if you're not seeking out reasons to get up in the morning and all that stuff.
I was about to say, you
Yes.
have to have a reason.
Yes,
and,
a purpose.
And a lot of seniors, whether they're in the places that we had talked about or even in their own houses, if they've had a spouse pass away that were married. My parents were married 60 plus years before my dad passed away, and unfortunately so did my mom eventually. But that's the majority of your life. You're with this person.
Yep.
All of a sudden it's not there.
That's right.
And sometimes they have kids, sometimes they don't. But loneliness, you hit it. It is so, and we overlook that. I mean,
Yes.
but I see it every day. I see it every day, and it's sad. But I'm glad I can be a source for people when they need help and stuff
Yes,
like that.
and we live in a city that is very, very pro senior citizen.
Very.
They provide so many resources,
Yep.
and so if there is an opportunity for, and even on this show, that's one of the reasons why I started doing the senior internships, which I do still have. I've got 2 right now that are working on projects for me that are retired, but I have an intern because that is a purpose. And
Yep.
Medicare can even become a purpose for people to navigate in research.
Plus,
And that's, yeah.
Not to interrupt, but I mean, you're getting, it's like you said, we're so passionate. So I'm part of the Friday Rotary. And one of the things we do is we build ramps for disabled people,
Mhm.
which we just did this past Saturday. So the gratification that these people show for providing that type of service, this particular lady had a wheelchair and a walker. She could barely get around, but when we were done with the ramp, it just, the satisfaction, gratification, and it's volunteers. Of course, we don't get anything from that, but
You opened up her world.
But you also realize there's so many people that have so many needs, and sometimes we just overlook that. And I'm glad to help with things like that as well.
Yeah, I think that that's a really good thing that we could also talk about is just, that's one of those, like the big event that happens every spring.
Yep.
Those are focused on opening up the world for people that are stuck in their own homes. And that becomes a thing too. So we'll open enrollment. So where can people go to, is there anywhere now?
Annual enrollment.
Thank you for correcting me. Annual enrollment. Is there a place where they can go to see Well, I guess it won't be available till October the 1st.
Yeah, they can
to
go to
look.
Medicare. All this stuff I've talked about today. I mean, you can go to Medicare.gov. You can Google. You can
Is it
do
on your
whatever.
website?
It's on my
Okay.
website. It'll be on this site here. And the most, probably the easiest way is just to contact me, whether by
Yes.
phone, text, email, through my site. And I will always give the most accurate, updated information. And if I don't know the answer, I don't pretend or make it up. I'll look for the answer and I'll share it with you.
And I think that we could take it one step further. If you're watching this and there are questions that you would like for Kevin to answer on the next episode, maybe
Yes.
we could do like a frequently asked question.
Yes.
Where just throw out an example or something that happened that maybe we could talk through.
I have many.
So,
and like you said, I can come up with a list of the top 10, 12, 15 questions that seniors have that maybe they don't know how to ask or they're afraid to ask, and we can talk about it. Maybe that'll help them out. That'll be good.
Well, good. Well, I really appreciate it. I think that this is going to be so interesting, and I think that we could have all kinds of episodes if we really wanted to.
Yeah, this has been so awesome. It really has, and I appreciate it.
Well, good. Well, until the next time, thanks, Kevin.
Yes, thank you.